everybody. We are live here at Dog is Good. And can I just say that I am so excited to be sitting at my desk. My feet are firmly planted in the ground. And I'm telling you this because I have been, gosh, all over the country this past month. And so it feels really good to be back and doing this broadcast with an amazing guest today who I'm super excited to introduce to you guys in just a moment. But as always, I want to give you a chance to pop on in. And as you do, please let me know who you are and where you're from and maybe who your dog or pets or household of pets might be that could be watching us today. If you're tuning in for the first time, I'm Gila Kurtz. I'm one of the co-founders and co-owners of Dog is Good, which is a lifestyle brand for dog lovers. We are the ones that speak to who you are as a dog lover and create all these amazing messages and things that celebrate that relationship. So you can always go to dogisgood.com to check us out. And one of the things that we do every week with this show is a giveaway. So I'm going to announce that right out of the gate and encourage you to enter. We'll put in the link where you can enter to win. And we will be giving away this week. These are so cool, actually. I just got a hold of them last week. They are socks. And this came up in a package here. Oh, here we go. They're very well packaged. So these are Never Walk Alone socks. They're super cute and super comfy. And of course, you're not going to walk outside without your Never Walk Alone travel mug. This is a 30-ounce vacuum insulated mug. And I'll tell you something, I was using one this weekend, and when you put ice in it in the morning, it's still in there by the time nighttime falls. So this baby really does work. So enter in to win. And then also, Dr. Richter is kindly donating a copy of his book, which everybody needs to get. And so do you have a copy you can show us? Awesome. The Ultimate Pet Health Guide. So that's what we're going to be talking about today, and you can get yours hopefully by entering to win, but certainly we'll give you access to do that later. And so joining us already from Alabama, thank you, Ann. I always love that you come on and you have such great feedback in here too, so I really appreciate your participation. And anyway, want you guys to share this with your friends. Either do it now or and actually if you do share it, we'll enter you into the giveaway contest twice. So we'll look to see. And hi, Dawn. How are you? And she's saying hello to you too, Dr. Richter.
Great.
So just to give you guys a quick update before we get started here with the interview, a lot of exciting things going on. We just closed out our first 2 minutes home contest. If you guys have not seen the videos, you need to go to our YouTube channel and see that. I mean, when I need a boost of something, I watch those videos. They are so heartwarming and they just make you feel so good. So check those out and stay tuned. Also, if you are not in our private Facebook group, you need to get in there ASAP because we have something spectacular planned for Mother's Day. It is going to be hilarious. It is going to be fun, and you are not going to want to miss the great deals. All the dog moms out there want to participate. So Barbara's here from Foster City. Welcome, Barbara. Thank you for joining. And lastly, I want to share with you, I have been getting some great emails. Actually, my team gets them and then they forward them to me, and I always get them at the perfect time. And this is around the fur-covered wisdom. So if you guys are not receiving fur-covered wisdom every Monday from your dog, you need to just go to furcoveredwisdom.com and sign up for that. And if you want to sign up your friends, because I had some people ask me how to do that, you just do it the same way. Just put your friend's name and their email and their dog's name, or dogs and cats, whatever. And every Monday they will get this note of inspiration. But the emails that we have been receiving have been just, this is just what we're about. We just want to inspire and help you guys live your best lives with your pets. So I really appreciate that feedback. Rhonda, aloha. Okay, I'm telling you, Rhonda, October. I'll be in Maui in October, so we will connect then. All right, guys, we're going to get started here because I have a very busy guest who's got a lot of great information to share, and I'm really, really excited to introduce him to you because everything that he talks about is something that I have been researching myself for my own personal health, and also for Bolo and little Henry as well. So lots of great stuff on a holistic approach to pet care, and I think it's going to be really informative. So I want to encourage you to ask questions and put those in the comments, and we'll get all those asked to you. All right, so without further ado, let's welcome Dr. Gary Richter, who is, there's so many consonants behind your name, who is a holistic veterinarian scientist. Dr. Gary Richter helps dog and cat owners to navigate the thicket of treatment options and separate the fact from fiction. He wants you to use what actually works, not just what Western science or alternative medicine say should work. This multifaceted approach to health is known as integrative healthcare. In this easy-to-follow guide to your pet's health, Dr. Richter examines traditional medicine from many cultures alongside modern medical techniques, describing the best of complementary care and the best of conventional veterinary medicine. Each treatment recommended in the book that we'll be highlighting today, it has the backing of scientific research or years of successful outcomes in its clinical practice. It's an integrative approach to health that includes nutrition and how that sets up as the foundation for your pet's health. And so Dr. Richter cuts through all the hype in the pet food world to explain how to make your own food or choose the best commercial food and supplements. And he also explains how you can use the right foods and supplements to hack the body's processes, including the immune system. He has been, he's a graduate of the University of Florida with a BS in Animal Science and MS in Veterinary Medical Services, Science, and has a doctorate of veterinary medicine with honors. Since 2002, he's been the owner and medical director of Montclair Veterinary Hospital in Oakland, California, and launched his holistic veterinary care in 2009. He's certified veterinary acupuncture, which I can't wait to talk about, as well as a veterinary chiropractic, also something I can't wait to talk about, and uses these therapies along with his veterinary medical education to achieve better outcomes for his patients. So you can also find him online, and we'll be posting all those links in here, but just a great wealth of knowledge and resource. Oh, and just a fun fact too, and not surprisingly, he was voted America's favorite veterinarian back in 2015 by the American Veterinary Medical Foundation. So anyway, welcome, Dr. Richter. Thank you so much for being here today.
Thank you so much. I'm thrilled to be here.
Awesome. So the first question I have, because I know there's a lot of people who are very familiar with all the different potential practices that are available to our pets, but some who are not. And so I wanted you to just give a quick explanation around what does it mean to be a holistic veterinarian?
Sure. So, I mean, there's a lot of definitions that people can use for holistic medicine. To me, holistic medicine are treatment modalities that effectively encourage the body to heal itself. So things that are, rather than sort of the kind of the pinpoint directionality of Western medicine, for example, say like antibiotics treating a specific bacteria, holistic medicine is more about treating the entire patient, treating the whole body to arrive at a better state of health than when we started.
Awesome. Now, when you are combining Western and Eastern type medicine, can you give me an example of like what that approach might be? Maybe it's with a particular ailment that you might see, or something that's unique. How do you determine which modality is the best course of action, and if and when they need to be integrated, and then how do you do that?
Sure. I mean, honestly, from my perspective, from a doctor's perspective, that's actually one of the most difficult things that I have to do, is really kind of parse out on an individual basis what are going to be the best therapies, whether it's a conventional medical therapy or an alternative therapy. But as a for example, let's take a dog with arthritis. We see a lot of dogs with arthritis, and there are a lot of therapies for dogs with arthritis. So from a conventional medical perspective, really, where the therapies lie are either in pharmaceutical anti-inflammatory medications, or in drugs that essentially help with and/or cover up pain. None of those options are definitively wrong, but the question is how do those options stack up against the more natural or holistic alternatives? For example, treatments that would actually improve the condition within the joint itself rather than just sort of cover up the pain. So, I mean, we frequently will look at herbs and supplements that have both anti-inflammatory and joint support properties. We utilize acupuncture and chiropractic and massage, laser therapy, pulsed signal therapy, which is using an electromagnetic field to stimulate tissue healing. So there's a lot of things that we can do. So, the way that I normally approach these things is I have to look at, for any given treatment, how effective is it likely to be, and what are the potential downsides? What are the potential side effects? And, we weigh all of those together and start to put together a list of the things that are going to be the most likely to be beneficial and the least likely to be detrimental, and custom tailor a treatment plan for that individual animal.
I love that. I like that it's not such a quick fix answer to cover the pain. I think that's usually the initial approach, is to make the animal feel more comfortable, and
Sure.
certainly inflammatory would be great. Just like, I know this might be a lame example, but I hurt my shoulder, and while I can take Motrin to help it, I know my friend who does acupuncture and also with some use of essential oils helps in that healing a little bit faster, but it's healing it's not just covering up the symptom, it's actually promoting the healing process so that it's not a problem down the road.
Yeah.
And I'm assuming it's the same way that you would be approaching with the pet.
Yeah, that's exactly it. So, I mean, I think one of the big differences between conventional medicine and natural medicine is, as I mentioned earlier, I mean, conventional medicine it's very narrowly focused. So for example, if you injured your shoulder, conventional medicine is going to want to put you on an anti-inflammatory to control the inflammation in the shoulder. But the question is what is that anti-inflammatory going to do to the rest of your body, particularly if you're going to be taking it for the long term? There could be implications as far as liver function, kidney function, gastrointestinal upset. Whereas if we look on the natural medicine side, interestingly, a lot of herbal and natural anti-inflammatory and pain relievers not only don't have those negative effects, but frequently they actually support liver function and kidney function and gastrointestinal function. So in a lot of ways, when you use natural medicine, you're getting a lot of extra sideline benefits that you didn't even necessarily even really plan on.
Right. Oh, that's a really good point. And going back to just this very personalized protocol that you're putting together, it seems too that a particular dog, depending on the age, depending on the breed, or just any other issues that might be going on with it, that what one protocol would be perfect for one dog may need to be slightly altered for another, just based on the makeup of that particular dog. So there are no, so the downsides are obviously much less, and that has to be delineated out on a case-by-case basis too, I would imagine.
Yeah, absolutely. And just to add on to that, the other kind of non-medical aspect of it is we need to put together a treatment protocol that actually is going to happen and get followed. So, if I, for example, if you come into my office and I lay out a treatment plan that for, either logistical or financial or practical reasons you can't follow, then it's not going to be successful. So we have to find something that not only works for the dog, but works for you from the standpoint of, can you make it happen?
Wow, you just really wrapped together what the holistic approach really is, because you're absolutely right. If the pet parent themselves cannot make that protocol happen, then there needs to be another option.
Absolutely.
Help it. I'm glad you brought that up. That's important. So, when I was looking on your website, well, there's a lot of things that fascinate me. And I do want to talk about the acupuncture and chiropractic because it's not something I'm familiar with in terms of I've never done it with my own dogs, and I'm just curious what that process is. But before I ask that, I do have a friend who his expertise as a doctor to humans is use of the hyperbaric chamber. And I was wondering how you utilize that and how you brought that into your practice as something that could be beneficial and in what cases that would be utilized.
Sure. So, to me, as an integrative medicine veterinarian, I'm always looking for other alternatives, other things that maybe are not readily available to people that can be used to help their pets do better. And that's kind of how I found my way to hyperbaric oxygen therapy. For the people that aren't aware of it, hyperbaric oxygen, effectively what it is it's a chamber that you put a patient in, and the chamber pressurizes with 100% oxygen. And effectively what that does is it drives oxygen into the body, into the blood, into the tissues throughout the body at levels that could never be achieved by not breathing not only just room air, but if you just sat in a room and breathed pure oxygen, you could never achieve that without the pressure. And because oxygen is very frequently the limiting factor to cells being able to heal, if we can push more oxygen towards an area that's injured, we can really stimulate and speed the healing process. So, for us in this office, we use hyperbaric oxygen for any number of things, ranging from non-healing wounds to injuries, any kind of trauma or injury to the spinal cord or the brain. Pretty much any medical condition that can be described as having either a compromise in circulation or a lack of oxygenation to the tissues can really benefit from hyperbaric oxygen therapy.
So how do you acclimate the dog to the chamber? Is it a problem? Are they afraid to be in there? And how long when you're putting them under, how long, I don't mean when you put them under, when they're being pressurized, what's the length of time?
Sure. Generally speaking, there's no problem at all from the dog or the cat's perspective. Dogs and cats, as a general rule, are not claustrophobic for smaller spaces. In fact, if you think about what your average dog or cat would do in a stressful situation, is they're going to go find the smallest space they can find and go there. As a rule, it's not a problem from the dog or cat's perspective, particularly after they get the idea after a few minutes that from their end of things, nothing happens. It doesn't hurt. They don't feel anything. All they literally have to do is sit there and breathe. So it works out very well in that sense. And to address your other question, usually most treatment sessions last about an hour. So it takes a few minutes to get them up to pressure and a few minutes to decompress when it's over. So all told, they're usually in the chamber for about an hour and 15, hour and 20 minutes.
Oh, okay. And how many treatments might, let's say it's a wound that doesn't heal. How many treatments would something like that require before you're starting to see the healing take place?
Sure. Much like everything, there's a lot of individuality to it, but I would say usually within 2 or 3 treatments, we can start to see some improvements and start to see some changes. Depending on how severe the wound is gonna depend on how long it ultimately takes to get it to heal. But usually we can start to see some positive effects in fairly short order.
Okay. So my only experience with this is a friend of ours, little Yorkie, was attacked, and the bigger dog grabbed the Yorkie by the head, kind of punctured it and whatnot, and it was, having brain damage. It had some brain damage, and it was walking. It could no longer walk straightly, or in a straight line. And so our friend just offered, "Hey, let's try this out," and it worked. And it did help help the Yorkie tremendously with the healing process, and also with his any of the neurological damage that had taken place. I don't know if it was 100% healed, but a significant improvement over what had been prior to this chamber treatment.
Sure.
So I was curious because that caught my attention.
Yeah, and along those lines, you see a lot of use these days of hyperbaric oxygen, not only for head trauma from the standpoint of people that have had, injuries, accidents, things go on the military, where there's concussive trauma, but also now you're seeing this a lot in professional athletes, particularly football players, who are sustaining repeated concussions. There's a lot of indication that hyperbaric oxygen can do enormous good in those cases as well.
Interesting. So acupuncture. How do you determine that this is in what situations might you recommend acupuncture treatment, and how do you guys actually do it? Do you have to sedate the animal? Is it just a relaxing? Tell me how you actually implement that treatment.
Sure. So I mean, the decision of whether or not to do acupuncture is it's largely the same decision as we would go through with any other treatment of, given whatever's going on with that particular patient, what is the likelihood that this is going to help? In the sense of acupuncture, there's very little, if any, downside. So we don't have to worry too much about that. But, frequently we'll use acupuncture for, animals that are having pain, gastrointestinal issues, allergies, anxiety. There's any number of indications for acupuncture. And no, to answer your question, we do not sedate animals for acupuncture. The vast majority of dogs and cats do great with it. They have no innate fear of needles like we do. So there's no apprehension on their end. And the truth is that most animals that get acupuncture lay down and go to sleep. I think they find it very relaxing, and they, the vast majority of them do absolutely great with it.
So do they have the same pressure points as we do in terms of what pressure points access certain things in our systems?
They're very similar. The points are somewhat adjusted just because of differences in anatomy. But generally speaking, from an anatomical perspective, they're very close to what human acupuncture points would be.
Okay, and then lastly, would there be any challenge in locating those points with the fur, or is it just really a tactic, technique?
Yeah, the fur is not an issue. I mean, finding acupuncture points is a combination of just anatomical landmarks, so just knowing where you are, but also some of it's just a feel thing of getting an idea of where that particular point is with a given animal. I mean, just like with people, these things are not set in stone. I mean, different people have different physiology, and thus their acupuncture points will vary a little bit. And that has a lot to do with just being in the hands of the acupuncturist to figure out what an appropriate point would be for that individual.
So for someone practicing acupuncture and veterinary medicine, are they getting their degree traditionally like a regular acupuncturist, or are they also having to do something for veterinary? Or is that a crossover? In other words, can a person who does acupuncture for humans automatically qualify to do it on pets? So what else do they need to know to do that?
That's a good question. So from the veterinary perspective, when veterinarians are trained in acupuncture, I mean, to be quite frank, the training is not nearly as long or involved as it would be like if you were going to go to school to be an acupuncturist for people. So it's kind of it's a shorter course, if you will. From the perspective of a more classically trained acupuncturist, it kind of depends on what state you live in. So, for example, in California, an acupuncturist can do acupuncture on animals, but they have to do so under veterinary supervision. So they're not allowed to just, sort of hang out a shingle in their office and say, hey, I treat animals too. But there is some variability from state to state in what the regulations are for that sort of thing.
Oh, okay. All right. Well, that's good to know. Would that then be the same for chiropractic as well?
Exactly the same for chiropractic, exactly the same for physical therapy. Any human practitioner, at least as far as California goes, would be required to practice under a veterinarian supervision.
Got it. So with chiropractic care, I would imagine, as oftentimes I'm thinking, like, I need to get myself to a chiropractor. But how, just what a relief that must feel like for the pet. So can you share a little bit about that and the experiences that the pets have, why you may offer that as a treatment or recommend it, and just what the the benefits and the results are for that cat.
Sure. I mean, I think anybody that's been to a good chiropractor will understand how much that can benefit you. And dogs. This is particularly a dog thing. Cats are interesting because most cats, from a chiropractic standpoint, seem to be able to a little bit better to manage themselves than dogs or people, for that matter. But I mean, dogs, especially active dogs, they play hard. They don't. Dogs are really great at living in the moment. But the downside of living in the moment is you never really think about the consequences of your actions ahead of time. So they go do things that, probably would have been better had they not done them. And they get kind of messed up, orthopedically speaking, just like we do. And it can be very difficult for us as humans to sort of really appreciate that, unless an animal is overtly limping. Plus I think it's important to remember that when you're doing, when chiropractic adjustments happen, it's really not just about moving bones. A lot of what you're doing is you're affecting their central nervous system. So, chiropractic is great for orthopedic things, but it really doesn't stop there. Because if you can access the central nervous system, then you can affect any number of potential medical conditions. So there's a lot that can be done with chiropractic outside of just orthopedics.
Oh, wow. I didn't think about that from that perspective, but you're right. All right, let's move on. Wait, first off, do you guys have any questions on any of this as far as the acupuncture and chiropractic care and just some of the cool stuff that he offers? So Rhonda says her dog just recently had his second acupuncture treatment for arthritis, cold laser therapy, and has been on Chinese herbs for a couple months now. Nice. She's asking, what can she expect to see as far as improvements continue to occur and when?
Right. I mean, a lot of it depends on what's going on with your dog as an individual, because it just kind of depends on the severity of his arthritis. It depends on where the arthritis is. So for example, arthritis in the spine can be a little bit more challenging to manage than, say, arthritis in a hip or a knee. But I would say if your dog, for an older dog that has arthritis, I would say you want to give it at least, somewhere between 1 and 2 months before you get an idea of how far down the road you can get. I mean, remember, let's just say, take a number. If your dog is 12 years old,